Good afternoon, North Dakota. Thank you for tuning in. As always, we're grateful for your presence. Thanks for whether you're watching in real time or online later. We appreciate your focusing in on getting the facts and helping us guide our state. You're an important part of the solution. Today we've got a number of things on our agenda, including an update that we'll have later on from our Chancellor of Higher Education, Mark Hagerott, our Chief Health Strategist for the state of North Dakota, Dr. Josh Wynn. They'll be speaking specifically on the North Dakota University Systems plan for reopening campuses in the fall. And then we'll also have a brief update on the economic resiliency grant process. But before we jump into any numbers, I want to spend some time focusing a bit on the need for us to make sure that we're continuing here in North Dakota to do the things we need to do to not find ourselves in the position that other states are where they're having to roll back some of their reopening efforts. Because I know that we've said all along that we want to save lives and livelihoods. And the way we save livelihoods and the way we keep moving towards opening up is to keep the pandemic under control. The pandemic, as everyone knows from watching the national news, continues to spread around our country. And lots of travelers coming into North Dakota during this time of year. So maybe we have to be extra cautious here during this time frame, and as North Dakotans travel around the state, we've got areas of higher risk and lower risk, and so again, we want to make sure that when we have this the call for exercising personal responsibility. When we've done that in the past, the case numbers and positivity dropped, and we want to do that again because right now we are not headed in the direction we want to. We'll go through that with some of the graphs. But one thing to jump on right away for the which was reported this morning, it was reported that we had 160 positive cases. That would have been our highest daily total so far. 52 hospitalization, that was also our highest number to date. The 52 hospitalizations, that's accurate. That's how many people are in the hospital today. We have 864 active cases. That's accurate. Since 11 o'clock this morning when we released the data, that's the time every day when we release the data, we've come to understand that in the lab that we had a major batch failure that occurred on Monday. And so a bunch of tests that would have been reported on Monday were reported during the 24 hours on Tuesday. So I think the way for us, the way we're looking at this and the way we'd like to share for the state when we're thinking about it in terms of policy decision making is that we're really combining Monday and Tuesday together as 2 days because we likely underreported cases on Monday when we were, or excuse me, Tuesday, we reported 82 cases from Monday. Today, we reported 160 from Tuesday because we report at 11 a.m. for the 24-hour period prior. The 82 that we reported yesterday was underreported relative to the test that came in and the retest run that was done after midnight. So again, if we look at those two together over those 2 days, 242 positives, just under 8,000 tests, 7,998. That's a 3% positive rate, and that would make more, fits the trend line that we've seen, and we're not trying to make it fit, it's just that is the trend line. And so as we work back through that, the data, there'll likely be a restatement of those 2 days to get these in line. But for the purposes this afternoon, we should think about that we've got a 3% rate over the last 2 days on our point prevalent or our daily positivity rate. That still sends us in the wrong direction. That means we're still climbing because we were in the 1% range a couple weeks ago, and we're still climbing. So it's not the time for us to panic, but we need to say that we've got to be really continue to be smart. We know that as we resumed and reopened, we created more transmissible moments, and whether those are weddings or sports events, whether it's bars and restaurants, hanging out on a sandbar on a beautiful day in the summertime. Whatever those events might be, we just need to be more cautious about transmissionable moments. And so again, if we want to slow the spread, this virus only lives in people, and it jumps if it makes one person sick and they become contagious, and then they can transmit it to somebody else. So one way to not get this is to, again, keep a distance from other people. That's what we talk about the social distancing, because it has limited ability to travel and travels less well outdoors than indoors. And so if you stay away from people and stay outdoors, avoid crowded indoor spaces, you lower the chance. So you can do your part in helping slow the spread by making sure that you're in a position, and if you can't social distance, you have an opportunity to wear a mask. There's 52 hospitalizations in the state, as I said. We have this morning talked to some of our large hospital leaders about their capacity and where they're at, and we have lots of additional capacity still in the state in terms of total beds and ICU beds, and so we're not at risk of hitting our limits there. But again, we like to see hospitalizations go down, not up. They've been going up, so again, just another piece of data for North Dakotans to take this seriously and make sure that we're being smart, so that we're all doing our part to help support our businesses and help keep them open, help us get back doing the things we want to do in the days and weeks and months ahead. Some other things, are contact tracers. We don't want to we want to share sort of generically the kinds of things contact tracers are coming up with, so that people might understand what's going on in North Dakota. This is like listening to the local weather, not the national, but there was a entire cluster of college students who all ended up positive, who were on a party bus that was rented. Again, and this is, again, I think we've seen from other states, alcohol gets involved, whether it's crowded bars or parties, and people forget the social distancing part of things. Wedding parties, a number of folks that have been where we've had contact tracing going back to wedding events, socializing around baseball, softball, other sports, college athletes that are training together. Those are all areas where we've seen clusters. We've also seen work-related cases. I spoke last week about the bank, but there's other offices, construction sites that are going on up in the oil field area, the energy sector, where we've had these clusters occur. And remember, again, this is not like the flu. This is something where you can be someone who's spreading it and not even have symptoms. And so again, the distancing and if you're not able to distance, wearing a mask are those things that can help slow the spread. But our goal remains unchanged, and which is that we want to save lives and livelihoods. And the way we do that is we test, we trace, we isolate, and then we preserve the hospital capacity so those individuals can be served at the highest level. We have seen a bit of a drop in the fatality rate. We hope that we don't see more deaths coming up following the higher hospitalization, because sometimes deaths could follow hospitalization. But in talking to our hospital leaders this morning, both in terms of therapeutics, how they deliver oxygen, the kind of care that's given is really improved in terms of our understanding. And so confident that if people get to a hospital in North Dakota, they're going to receive fantastic care that is going to help them make it through this challenging disease. And so again, for those that are out there knowing for the 4 months, we have not changed the goalposts. We're focused again on doing everything we can to save lives and livelihoods. We know the virus will spread, but if we slow it down, that's going to allow us to keep businesses open, help us get schools back open, and all the things that we want to be doing going ahead. So let's take a look again at our North Dakota SMART guidelines to maybe sum this all up, which again is pretty straightforward. These also haven't changed. Again, distances can be one of the first tools in your toolbox. It's free, doesn't require any. The government, can't mandate it. The government can't control it. The government can't police it. This is individuals just being smart about the distance that they are away from each other. Washing your hands frequently, because we know that this is a way that can be transferred through hands and services. And then again, shaking hands, not a good idea if you've got any concerns about the situation that you're in. And then again, wearing masks when appropriate, and wearing masks when you can't socially distance. And then of course, try not to touch your face, because that's how it can get, if you got it from somebody else on your hands, you put it into yourself by touching your face, your nose, your eyes. So avoid doing that. And then of course, we know lots of businesses and schools and others have been working on disinfecting surfaces so that we can keep your customers and your staff healthy. So thanks for that. Let's jump into the last 7 days of testing. And again, I want to walk through these, but I've got a slide issue here where things aren't showing up. So I'll just look over my shoulder for a second. In the last 7 days, the 806 positive cases, and that's and we'll cover actives in a minute. We've had quite a few recoveries, but that's a we've had an increase in actives. We've had 32,000 tests completed in the last week, last 7-day period. I believe that's a record. And again, the positivity rate, dividing the 806 over the 32,356, 2.5% positivity rate. And then again, as I stated at the opening, over the last 2 days, that's crept up. When we combine the results of the last 2 days of the last 7, it's up to 3%, which is again heading the wrong direction. Cumulative on the right-hand side, that's the number of cases divided by the number of individuals in North Dakota, gives us our cumulative 3.9%. We're going to do a little more of a breakdown on this as we get further into the program. On the North Dakota testing from a serial testing point of view, still having the problem here, so I'll keep looking over my shoulder. We have tested, remarkably, conducted almost 271,000 tests in our state. And as we show going back over the last couple of weeks, going back to near the beginning of July, the bottom of that shows the new individuals that are tested. The top is the people that are repeat testing, and we'll talk again in a little bit about the importance of why we're testing people multiple times. Okay, on the and this takes it all the way back to beginning of May. Beginning of May was when we started showing graphs at these reports, breaking out the serial testing from the individual testing. As all of you know that are here and have been watching, we report this every time we have a press conference. And this again shows the growing number, and this is also part of two things. One of it's part of us having the testing to be able to do surveillance testing. Some of it's testing vulnerable populations like people in residence in nursing home, and it's also about testing high-risk individuals, because if someone gets a test and they test negative, but you're a healthcare worker and you're working around people with COVID, and we test you again the next week, and we test you the next week, each of those tests are valid. Each of those tests matter, because that's related to the point prevalence on that day. Are we uncovering the spread of the virus in North Dakota? So any comprehensive and responsible testing strategy has to include serial testing. North Dakota is doing it as well as anyone, and so this is why we've been reporting it to everybody, so people understand. Mathematically, if you carry that all the way forward, let's just say we get to the point where every single person in the state of North Dakota has been tested from a serial standpoint. If we can go back to the prior slide, if everybody's been tested once, and then we went out and tested people, and we came up with 10 positives, and they were all people who'd been tested before, and somehow the serial testing didn't count, I guess then that would mean we'd have 100%. If they were the last 10 people in the state that got tested, we'd have a 100% rate. So again, as we had in the very first slide, we've been reporting it both ways. We're reporting it cumulative as a percent of individuals, and we're reporting it in terms of the people that we took the tests of that in a day, and that any epidemiologist will tell you that that's the valid, appropriate way to be doing this. Going forward here, to the next slide. Again, on the active confirmed cases of 864, we got recovered 647. So you can see we've jumped by more than 200 active cases in the state. That's over the past week. That's the thing that can start to put pressure on healthcare. This is the thing that can cause the outbreak to spread, because the more actives there are, if we don't find them and they're not isolating, then those can infect other people. So we are watching the active cases closely as we are the hospitalized. Over the last week, sadly, the deaths are up 8 from 88 to 96. A woman in her 60s from Montreal County with underlying health conditions, a woman in her 80s from Morton County. Those underlying health conditions are still unknown. A man in his 30s from Benson County with underlying health conditions. A man in his 80s from Burley with underlying health conditions. A woman in her 70s from Williams County with underlying health conditions, and a woman in her 90s from Cass County with underlying health conditions. A man in his 70s from Burley with underlying health conditions, and another woman in her 90s from Cass County with underlying health conditions. And again, on behalf of Lieutenant Governor Brent Sanford and the First Lady and myself, we extend our condolences to all of those families who've lost someone in the past week who've passed away with COVID. In terms of our testing and active cases, this is a chart we put out on social media last week where we're tracking so people can see the daily test conducted is in the gray, the active cases in the gold. And so we did have a good downtrend, heading through the end of May and through the end of June, where active cases were trending down. That was fantastic. Testing was going up and cases were going down. That's what you want to have happen. That's why we kept having lower and lower positivity rates. Since the 4th of July time frame, or a little bit prior to that, we started to see an increase in active cases. And right now, the rise in active cases is outpacing our rise in testing. So you can explain a portion of the increase to the rise in actives because we're just finding more cases and doing a better job of testing. But you can't explain all of the rise because of more testing, because the slopes of those two lines are different, and clearly the active cases outpacing the testing, which then that shows up in our positivity rate. As we talked about, our positivity rate is going upwards. The rolling average, again, this is the 14-day rolling average. We've got the state of North Dakota in white, Cass County in blue, and Burley Morton in gold. And you can see here that when we go back to, this is May 21st, I think, is the first data point on this chart, but then it would have been 2 weeks of data prior to that. So each daily point on this chart reflects the average of the prior 14 days. It would help, smooth the data and help us really understand the trend lines. We did a great job, the Red River Valley Task Force and the work in Cass County, bringing the Cass County numbers down to the state line. Burley, which was sort of on the early involved, then was really on the sidelines for a while in a positive way, is now coming up and tracking kind of neck and neck with Cass County. And we can see from June 30th to today where we've gone as a state from below 1% to about a little over 2%, and in our two most populous metro areas, the Burley, Morton, and the Cass County area, we've gone from under 2 to approaching 3, which I've talked about. This is a early warning sign where we have to continue to make sure that we're being smart about being the North Dakota SMART guidelines to make sure that we reduce transmission. Active